Hey guys, every year thousands of foreigners flock to Bangkok for medical tourism. It's just a big business here. Of course, it's down this year because of the COVID. There aren't many foreigners here. But I'm about to go into a dental clinic and see how much I can save by getting a checkup, and through the checkup also finding out if I have any cavities or whatever. So I'm going to be walking across the street to Bangkok Smile Clinic, a place I went to years ago. I just want to find out if it's as cost effective as it was last time I was there several years ago. So let's go across the street and check it out. That's where we go from. Okay.
Bye-bye. Yeah, I've been here for so long. How you feel?
Fine. Did they clean your mouth?
Yeah.
So he told me I have 2 cavities up here, and I could get fillings, not crowns. So he said you can get filling.
Yeah, I can
instead
get
of a crown.
Yeah.
Okay.
He can try to do that.
Okay. So maybe next week we come in.
Filling?
Yeah.
Yeah.
See, they clean my teeth really well.
Good.
So they look whiter than before, right? Yeah.
Good cleaner.
Okay, up there.
I think we're going to do really confident.
Okay. Can you give us a price estimate?
Also, one moment, please.
You happy about your doctor?
Yeah, I thought he was really great. So our combined fillings were 2,500 baht, which comes out to about, let's see, $80, right? $80 for both of us. In the U.S., this would be about $120 for each of us, or $240. So U.S. $240, here $80. So 1/3 the price. We both have cavities to be filled, to be worked on next week. And according to what they're telling us, I have 2 fillings. That's 3,000 baht, so that's $90. And you have 1, and it's $1,030.
$30.
So that's, let's see, 30 plus 90, $120. Woo. In the U.S., it would be at least $500 to $600 for that done. So we're talking about, let's see, I don't know, it's probably 1/4 the price for the filling. So this is why, Thailand has so much medical tourism. So keep that in mind, keep this clinic in mind. I think it's a very good clinic. You can do a lot cheaper here, but cheaper than here, but there's a lot of small Thai clinics. But this clinic takes a lot of foreigners, and it's still, at least as an American, it's very cheap here. So you might want to consider this. Next thing we're going to do is we're going to look at a hospital. Anne's going to go in for a physical checkup, right? And we'll compare that price with what we have to pay in the U.S. See you next time. So the next day after our dental appointment, Anne made an appointment to get a 4-hour comprehensive medical exam.
Here we are walking through Chinatown in part of Bangkok on the way to Anne's hospital appointment. Here we are at Samitivij Hospital. One more look at this. This is the hospital Anne's going into. Samitivij is one of the best hospitals in the country. This is a private hospital, so it's much more expensive. So it's surrounded by temples. That's got to be a good sign. And it's one of the most expensive hospitals in the country, and known for its good doctors, many of whom are internationally trained. Anne has scheduled a 4-hour workup. This is a complete physical. We'll give you a list of everything she's going through here. And the total price is 10,700 baht. That sounds like a lot of money, but it's really just a little over $360. I think when we compare that to a 4-hour workup in the US, for instance, where we are, we'll find it incredibly cheap. But we're gonna go in, Anne's gonna check in now. Now, hospitals do frown a lot on people taking pictures. So we're gonna be we may not be able to take any pictures, but if not, we'll just talk to you when we come out in 4 hours and let you know all about what was done, and we'll start comparing this to hospital prices in the USA. Let's go. You have anything to say? You worried?
No.
No, you worried you're up for a 4-hour exam? You don't want to do it? You gonna chicken out?
Really?
You ready to go?
Yeah.
Okay, let's do it. We were met at the door by 2 very kind nurses and escorted to Anne's doctor's office. Okay, so Anne is about 3/4 done with her examination. You've been in there, what, at least 2 hours, maybe 3 hours already, and this is our lunch break. So how's it going so far?
Everything going smooth?
They basically tested everything, basically your heart, your lungs, your eyes, your organs,
Yes,
right?
whole body shape.
Reproductive system, right? Everything. Huh? They give you an X-ray on your breasts.
Yes.
Right? Okay. So and then she's had
That's
blood.
my first experience.
First experience.
First time.
And they give you an ultrasound all over, and they give you a blood test.
Yes.
Okay. They've taken all sort of samples from everything that's inside you, right? So what do you have left? Do you have a stress test left? And anything else, you know?
Yeah, another thing I can't remember.
Okay. So she's probably got about another hour of testing. As I said before, this 4 hours of the testing is we're spending about $360 on it. And I've been trying to find out how much it would be in the U.S., but U.S. hospitals are not very open about how much they charge. But from what I've seen, for a full battery of tests like Anne has had, which is going to be taking about 4 hours, it's anywhere between $700 and $1,500. That's if you don't have any insurance. In the U.S., Anne doesn't have any insurance because she doesn't work.
I don't work.
Well, she's a housewife, right?
I work around the house.
And we also work on this channel, right? So she doesn't have insurance. So if she was to get the same test in the U.S., she'd probably be spending, my guess is well over $1,000. So we're doing this for about 1/3 of the cost we'd spend in the U.S. So it's pretty interesting. We're finding out a lot about how much cheaper the healthcare costs are here in Thailand than they are in the U.S. What do you have to say? Anything? Are you surprised how much cheaper they are?
I don't know. I never been to the hospital in the US before.
Thank God. It bankrupts most people. Anyways, the healthcare in the US is very, very expensive. And so it's been a problem in the US for a while now. So a lot of foreigners do come here, not just from the US, but from all different countries, they come here for as medical tourists. And so now we've been to this situation where Anne's getting a full medical workup, and we've also been to a dental clinic. So we'll get back to the results as soon as Anne gets out of here and we get all the printouts. We'll get back to it, but I think it'll be kind of surprising.
I'm done. I packed everything. Yay! You happy?
So she got a full screening and she got a clean bill of health. So Anne is doing great. Probably gonna live to 300 the way things are going. Definitely gonna outlive me. The savings for doing medical tourism in Thailand are obvious, both dental and for going to the hospital. And I just wanted to let you know that savings can be made by coming here to do medical tourism.
And you can travel here in Thailand.
Right? So please give us a thumbs up and please subscribe to our channel.
And then we will see you again in the next trip in Thailand, together somewhere.
Okay, see you soon.